Guys, welcome back to Medical Coding with Blue. Today's episode is all about the medical coding credentials. If you're brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so if you are brand new to medical coding, perhaps you're still in school and you keep hearing about all of these credentials and which one should you get. Well, this video is going to explain briefly the 4 main medical coding certifications. Now, I am only talking about medical coding certifications, not the degree designations today. Okay, so let's just get that out of the way. The 4 main medical coding credentials that employers will look for is, the first one is going to be through the American Health Information Management Association. There's 3 with them. There's the Certified Coding Specialist. This is the gold standard of medical coding credentials. This says that you have mastered the inpatient medical coding and the outpatient medical coding, okay? And then there's the Certified Coding Associate. This says that you have the entry-level competence to get into the field and that you know and understand how to code the inpatient side, the ICD-10 PCS coding, and you know how to code the outpatient side, the CPT coding as well. So this says that you have that knowledge. It has the most domains of the medical coding certifications, so it does cover a lot, all right? So there's that one. So if you are brand new and you have no previous background, the Cpc-A may be the way for you to go. Now there's also the CCSP, that is a Certified Coding Specialist Physician-based. This is the mastery of the outpatient medical coding. So it's really geared towards the CPT manual. There is nothing in the CCSP about ICD-10 PCS, all right? So just keep that in mind. If you are interested in taking a medical coding certification for the outpatient setting only, and you want to go with AHIMA, the American Health Information Management Association, then the CCSP may be for you. So then there is the American Academy of Professional Coders. They have their flagship credential, which is the CPC. That is a Certified Professional Coder. That is the coder that can code in the outpatient setting. Again, it is geared towards the CPT manual. If you look at the website for either one of them, they'll have the breakdown of the exam. And for the CPC, you'll see that it's broken down by chapter, but it's mixed all together. So don't think that that's the format, okay? It is just giving you an idea of the topics that are on that exam. So something else that you should know about these credentials, all you need is one. All you need is one certification to start. I always strongly recommend to my brand new medical coders out there, there's a lot of temptation and a lot of talk about, oh, if you have a bunch of credentials that you'll get hired faster, you'll make more money, and this is untrue. So do not listen to that noise when you hear it, because it's really not true, guys. I've had one certification for many years. I had it for 13 years. I had the Cpc-A, and I made more money than nurses. I made more money than degree holders with it, and I only had one certification. What pays in this industry is knowledge. That's what pays. Knowledge and your time in, that is really what is going to start counting. But when you are starting off at the beginning, it is really easy to get kind of caught up in all of that, oh, rigmarole, and I want to try to make myself look good, and I want to have all of these credentials. But if you don't have the experience to back up those credentials, it's an issue, guys. So just take it from me, just take it slow. Your first 2 years as a medical coder, you really should only have one certification. And yes, there's going to be these schools that will try to push the extra ones on you, but every additional credential you get, you have to come up with more continuing education units. And that's not really something that you want to be kind of worried about, like, how am I going to get even more CEUs if you are just brand new and trying to find a job, all right? So you do have 2 years to report your CEUs, your continuing education units, and all of the credentials require continuing education units to be reported every 2 years. The American Health Information Management Association and the American Academy of Professional Coders both have a 2-year period where you have 2 years to report all of your CEUs. And with AHIMA, they require 20 CEUs for one certification in medical coding, the CCS, the Cpc-A, or the CCSP. If you have one of these, all you need to come up with in those 2 years is 20 total CEUs. If you are with AAPC, it is going to require you to have 36 continuing education units. That is a lot, and it does get costly, guys. So something else that you need to consider when you're trying to figure out which certification to go through, all right? You're going to hear that the CCS is very difficult. All the exams are very difficult, but that CCS really does require a lot of knowledge. So if you are in a program and you don't feel like you're prepared enough, you can look at the other certifications and then maybe revisit. I was going to come back to it, but you can revisit attempting to take that certification, all right? There's a lot of people that try to take it right out of the gate, and some people can pass it and some people don't. So it really all depends on how diligent you are studying, that you're not relying on these prep books, these exam prep books. The CCS is notorious for this. Even the one that's published by AHIMA, there's a lot of people that complain to me. None of those questions were on the exam because they're not supposed to be. That test book is meant to prepare you as far as like the time and how it feels, not that these exact questions are on the exam. And there's people who make the mistake of just really studying those books very, very intently, and then they're very disappointed when they don't pass. So that's something that you have to be aware of. I've had plenty of my recommended books, and you can see them in the description box below. All of the books that I recommend are in the description box below. All you have to do is click more information, and it gives you all the details and everything. I do have the Amazon affiliate links. You do not have to click on those. You can simply look at the title and then try to find that book wherever you find your books, okay? So that is my advice there. But when it comes to selecting an association, whichever one you choose, both of these are reputable. The American Health Information Management Association and the American Academy of Professional Coders, they are both reputable associations. So just pick one and focus on preparing yourself for the exam that you want to take, whether it is the CCS, the Cpc-A, the CCSP, or the Cpc. Any one of these, and employers will know that you have the competence to get into the field, obviously, but that you've passed the standard exam. So that's where you want to begin your career. There's a lot of other associations out there, guys, I don't like to talk about on my channel because my channel is for serious medical coders, and I'm only going to tell you guys things that serious medical coders would want to know. I'm not going to waste your time with other associations that have no impact on this field, because as you can see in these job listings, and I invite you to look at these job listings in your area and see what certification employers are asking for. And then if you are still having a hard time trying to decide, go ahead and look to see which one is asked for the most in your area and go with that one. That was how I made my decision to go with the Cpc-A in the beginning, because I had the option of sitting for the Cpc as well. And I said, okay, well, a lot of people are asking for the Cpc-A here, so I'm going to go ahead and I'm going to sit for this one. And I am extremely glad that I did. I will always be proud that I had the Cpc-A. I had to put it to bed, but that's just an industry thing, okay? So, but that's my message for today, guys. I know it's a lot, but just pick one. A lot of people start spinning their wheels and getting kind of concerned and, oh, which one should I do? And they overthink a very simple task. So don't do this to yourselves. Pick one, study for it, and then take it, all right? So whatever you decide, it's going to be a great thing, because again, you're already set up for success taking one of the 4 main medical coding certifications, the CCS, the Cpc-A, the CCSP, or the Cpc. And that's my message for today, guys. Thank you so much for watching. I hope that you will like, subscribe, and share, and I will see you guys next time. Bye.